Everyone knows that mental health is an important. More than 13% of people aged 12 and above are already experiencing significant depressive symptoms. Why is there so many people in the US having more and more depression? Why are we still so far behind in recognizing it? What are the warning signs? When pain goes unheard, people look for escape.
If you are motivated by an obsession with gambling,
when should people identify themselves as, oh, I have now got a drinking problem? Alcohol or opioids? What's more dangerous in depression?
alcohol. Be very cautious about using an organism not under stress is a dead organism.
Why, in an era of medical advancement, are so many minds still left untreated? Today, everyone knows that mental health is as important as physical health. But why are a few common things like depression so common, yet they continue to be ignored? Not in adults, not in men or women, in children, and increasingly in young adults as well. Recent US data shows that more than 13% of people aged 12 and above are already experiencing significant depressive symptoms at any given time. Meaning, depression is no longer a future risk. It's at present a reality, especially among younger generations. Even more concerning, 1 in 15 adults meet criteria for major depressive disorder within a single year. Yet, many remain undiagnosed, untreated, or dismissed. And this crisis doesn't stop with the young. Our elderly, people who work their entire lives, raise families, build communities, are now retiring into silence. Studies show that late life depression affects a significant proportion of older adults, often driven by loneliness, loss of purpose, declining health, and social isolation. Depression in older age is frequently overlooked, misattributed to normal aging, and tragically undertreated. Postpartum depression affects a substantial percentage of new mothers and remains one of the most under-recognized mental health conditions in the society. And when pain goes unheard, people look for escape. Alcohol becomes normalized. Yet recent evidence shows that nearly 30 million Americans meet criteria for alcohol use disorder. And many report using alcohol specifically to cope with sadness, anxiety, or emotional numbness. A patient sits across from you. They hear voices, not outside but inside. Feel fragmented, reality becomes unstable. This is schizophrenia. A 25-year-old woman lived a normal life, surrounded by friends. She worked, laughed, and planned her future. Everything seemed fine. Then quietly, her world began to shift. She grew restless. Sleep became impossible. She became distracted, anxious, detached, and then the vision started. She saw herself outside her body, not a reflection, not a dream, a full moving presence, stood in the same room. She described a moment that shook even her doctors. She saw herself stab her own body. Not whether mental illness is common. The question is, why are we still so far behind in recognizing it, treating it, and talking about it in 2026? Why do we normalize alcohol? but stigmatize depression. In an era of medical advancement, are so many minds still left untreated? Today's conversation. Welcome to another episode of Khan Klinics. I'm your host, Dr. Amir Khan. And to help unpack these big questions, we're joined by one of the most respected and insightful voices in the field of behavioral health, Dr. Michael Abrams. Dr. Abrams is a senior researcher at Public Citizens Health Research Group. He has over 35 peer-reviewed publications and 25 years of experience. Dr. Abrams brings deep expertise in behavioral health, substance use, brain-based illnesses, and health policies. He holds an MPH from Johns Hopkins Bloomberg School of Public Health and a PhD in health policy from the University of Maryland. His work has influenced national health strategy discussions and policy frameworks, including consensus activities at the National Academy of Sciences and the National Quality Forum. Dr. Abrams has worked on depression, addiction, schizophrenia. Depression, a medical condition involving persistent low mood, fatigue, poor concentration, and loss of interest that interferes with daily life. When the body adapts to alcohol or substance use, leading to tolerance and withdrawal symptoms, that's dependence. So many people in the US having more and more depression, and yet they're not being diagnosed adequately. Why is it on such a high rise?
Depression is really kind of at the core of that. I mean, the symptoms of depression are sometimes difficult to identify and differentiate from sort of normal life challenges, right? I mean, it's been said by many a philosopher in one form or another that an organism not under stress is a dead organism, right? I mean, on some level, we as human beings strive to do things. If we're not failing or being challenged, it probably isn't very interesting. That might send us into a downward spiral, but typically we meet challenges, even today for this kind of illness. That's one of the things that makes it so very challenging to diagnose, to get to one of your points. But one of the reasons it's hard is because it's hard to diagnose. It's also because people are resistant. People are depressed, are resistant to sort of seeking solutions.
Thank you for answering the question. I think that's appreciate that. If depression is so common, why are we still seeing a rise in the US, you think?
Well, so I haven't looked at the epi data lately, but let's just take the COVID surge as one thing that led to increasing concern. So in 2023, Vivek Murthy, who was then the Surgeon General in his second term as Surgeon General, in fact, issued a report about loneliness. Okay. And that's a really important report. The Surgeon General's moniker is a really important one. They're the head of the, part of the head, the leadership of the public health service is 5,000, uniformed employees who are focused on, medical wellness and overall wellness of the U.S. population broadly. And he decides to issue this report at a very timely moment in 2023 and talks about the impact of, this COVID crisis was very challenging. And among the challenges was how it socially isolated kids, right? Especially troubling. But everybody had a sense of feeling isolated. And that certainly led to spikes in need for mental health services. And coming up with solutions to address that, like the interface we're using right now, right, to web-based interfaces, right? So I think it's, in terms of depression, I'm not sure that we necessarily that number that I cited of 20% for mental disorders has been a number that's been around for many years, and it spans a broad constellation of illnesses. So I don't know necessarily. I feel like it's going up. It may well be. Although we're not great, we've never been very good. Only about 20% of people who need treatment for a mental illness get it right now. right? And that's been the true for a long period of time. There are assaults on funding we can talk about that just, manifest like yesterday with the SAMHSA announcement by the Trump administration that then within 24 hours got revoked because people who understood mental illness screamed literally through their members of Congress at the administration, said, don't cut SAMHSA, the Substance Abuse and Mental Health Service Administration. So I think we've long been in a pattern where we haven't dealt with it as well as we should, although there's been maybe increasing awareness leading to more diagnosis. But I don't want to overstate that. This isn't like autism, where years ago, autism was defined very narrowly as people who were nonverbal, had very severe cognitive delays, very bizarre behaviors. Now, the definition has completely transformed autism so that it's far more common. I mean, they're high-functioning people. Elon Musk, perhaps, could be autistic spectrum. That obviously is going to expand that prevalence. Depression, more awareness, some better drugs have emerged, and so forth. And I feel like in recent years it has kind of waxed and waned in terms of whether people have been willing to go get therapy, have the resources. Is there healthcare coverage for them to do it? It's not inexpensive to get therapy and so forth. So it's a more nuanced pattern, I think, than a dramatic increase.
Thank you for explaining that. Let me move on to the next question. Would you say what are the warning signs that someone is moving into mental health struggles?
That's a really good question. Our social well-being is a really good indicator of behavioral health, right? So abrupt change observed by people close to you is a real important sign.
Yes.
In the moderate range,
Yeah.
to severe, is as bad for your health in terms of things like even, things you wouldn't think necessarily would be related, cardiovascular outcomes, right? Is as bad for your health as smoking 15 cigarettes per day, okay? So you don't want to neglect your mental health. And one way I'm suggesting that you see signals of that is if your friends are concerned about you, your ability to get to work, get to school, be happy, enjoy things you normally use. Those are all signals. If you're motivated by an obsession with gambling, sexuality, opioids, alcohol in a way that you weren't before, that's a signal of serious trouble.
Let me move on to another question where you have previously described alcohol abuse and alcohol use being associated with depression. And you just mentioned that in your conversation now. Explain to our audience, when should people identify themselves as, oh, I have now got a drinking problem?
Yeah. So strikes epidemiologic research, hits against just long-term health safety in terms of epidemiologic research. The symptoms of use disorder involve things like important symptoms like you wish you could consume less. If you get to a point where you feel like you wish you could consume less, but you can't, that's a problem. Find yourself doing dangerous things related to your alcohol use, like operating machinery or an automobile. That is very bad. And want to be straight with folks. It's not just bad right for you, it's bad for people around you. When you drink alcohol, it changes your personality, not just acutely a little bit buzzed, right? But it changes your personality in a way that you can't fulfill your obligations socially. You can't fulfill your obligations at work or at school. Certainly, if a child is consuming these things, that's an immediate red flag that needs to be addressed aggressively.
Alcohol or opioids? What's more dangerous in depression?
Alcohol.
Binge drinking or daily drinking? Which causes more harm?
Binge.
Tolerance or dependence? Which develops faster?
I think you'll find tolerance first.
Moderate or heavy? Which damages health more?
Heavy, certainly.
Relapse or withdrawal? Which is more dangerous?
Relapse is worse. Withdrawal is hard, though.
Your view on screening is better or education is better?
Both are important. Screening, as I described it.
Your final message to the audience, please.
So I would say this, it's nice to talk to you, Dr. Khan. Thank you for having me. Depression is only one of many areas of the healthcare system that I follow, but like I said, it's certainly an important one. And I think at this time that the message I would leave your audience with is we're at a moment right now where there are a lot of machinations going on in the healthcare system in the United States, because once these kinds of illnesses take hold, they are difficult to treat, and really after many years of detailed research, it's really the case that nobody ever really completely recovers from these kinds of illnesses. So we are at a moment now where it's more and more important for the American public to seek good advice from good clinicians, and sadly not necessarily from the Center for Disease Control and Prevention, I'm sorry to say, or from the Department of Health and Human Services, at least under the direction of Robert Kennedy.
Thank you so much for sharing your expertise and helping us bring clarity to an issue that is affecting millions of people silently.
My pleasure.
What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Klinics.